We're going to be looking at the Therapeutic Use Exemption, so the TUE. Now, this is a formal medical authorization that allows an athlete to use a prohibited substance or method for legitimate medical reasons without facing anti-doping violations. It is an essential part of anti-doping regulations, ensuring that athletes with medical conditions can continue to compete while maintaining the integrity of sport. Now, sports therapists play a really important role in managing injuries, rehabilitation, and advising athletes on medical use. Now, understanding the therapeutic use exemption regulation is vital to ensure that athletes receive proper medical care without breaching the World Anti-Doping Agency regulations. Why is this system necessary? So this system exists to strike a balance between protecting clean sport, so preventing unfair advantages due to performance-enhancing drug use, ensuring athletes or the athlete's health and well-being, so allowing essential medication for people with genuine medical conditions, providing fair access to competitions, so ensuring athletes with chronic conditions, so if they're asthmatic or diabetic, and not disadvantaged. Now, without the therapeutic use exemption system, athletes suffering from asthma, diabetes, arthritis, or severe injuries could be forced to either compete without essential treatment or risk breaking anti-doping rules. So, for an example, an Olympic sprinter with asthma may need a certain type of medication to help them breathe properly during races. Now, without a therapeutic use exemption, this medication could result in a doping violation. Now, with a therapeutic use exemption, they can legally use the medication and complete fairly. So, how does the process work and who needs one? So, athletes require a therapeutic use exemption if they are prescribed a medication that appears on the World Anti-Doping Agency prohibited list. Now, common conditions requiring a therapeutic use exemption include asthma, diabetes, severe allergies, chronic pain or autoimmune disorders, and heart conditions. Now, the application process. So, athletes must apply for a therapeutic use exemption before using a prohibitive substance in competition. Now, the process involves a medical diagnosis and justification. So, the athlete's doctor provides medical evidence providing the necessity of the medication. Then, submitting the therapeutic use exemption application. So, the athletes submit the application to their national anti doping organization. So, for example, in the UK, we would use the UK Anti Doping or the International Federation. There's a therapeutic use exemption committee review. So, a panel of independent medical experts review the case. And then they get approval or denial. So, if approved, the athlete receives a therapeutic use exemption certificate, permitting the use of the substance. So what are the criteria and what makes a valid therapeutic use exemption? Now, to receive an approval, the following four key criteria must be met. So, the athlete has a clear medical condition. The condition must be legitimate and well documented. So, medical tests, doctor's reports, and diagnostic history are required. Now, the prohibited substance is necessary for treatment. There must be no reasonable alternative treatment that is not banned. For example, a diabetic athlete needs insulin. There is no non-prohibitive substitute for this. So the medication does not enhance performance beyond normal health. So the drug should restore normal function rather than provide a competitive advantage. So, for example, insulin is vital for glucose regulation in diabetics, but does not enhance performance in healthy individuals. Now, the use of the substance is not due to prior drug use. So, athletes cannot claim a therapeutic use exemption for banned substances resulting from doping abuse. So, for an example, an athlete misusing anabolic steroids cannot apply for a therapeutic use exemption after experiencing hormonal imbalances. Why is it important for a sports therapist to understand the therapeutic use exemption regulations? Now, it's essential for ensuring athletes stay compliant with anti-doping rules. So athletes often assume that all prescribed medications are safe, but many are on the World Anti-Doping Agency prohibited list. Now, sports therapists must check the World Anti-Doping Agency guidelines before an athlete takes medication. We're not allowed to prescribe, but an athlete might be given medication or they might be on medication. So it's really important that we check this website to make sure it's not a banned substance. Advising athletes on alternative treatment. So if a prohibited drug is prescribed, the sports therapist can seek advice from non-banned treatment options. So looking at all of that. Sports therapists can also support the therapeutic use exemption application so they can help collect medical evidence and assist the medical doctors in preparing the documentations. Athletes often need functional assessments and rehabilitation reports where therapists can provide to support the kind of necessity of the medication use. Identifying high-risk medication and injury management. So there are certain medications that are high risk, which an athlete could be advised to do. So things like opiates, anti-inflammatories, that kind of thing, injections, and they may require a therapeutic use exemption if used close to a competition. So sports therapists should collaborate with team doctors to ensure compliance. How to check if a medication needs a therapeutic use exemption form. So athletes and support staff, and that includes sports therapists, can check whether a medication is prohibited. Now we can use these three different websites here. So we have the Global Drug Reference Online, we have the World Anti-Doping Agency prohibited list, and we also have the UK Anti-Doping website. It's really important that we check medication, even over the counter medication, to double check that it's not on the banned list. So kind of the key takeaways from this really short presentation: the therapeutic use exemption system ensures fair competition by allowing athletes to receive necessary medical treatment without breaching anti-doping regulations. Common conditions requiring therapeutic use exemptions include asthma, diabetes, allergies, and autoimmune disorders. Sports therapists play a vital role in ensuring compliance, helping athletes navigate safe rehabilitation, alternative treatments, and application processes. Always check medication against the World Anti-Doping Agency prohibited list before an athlete takes it. So this is prescribed medication as well as over-the-counter medication. Now, by being therapeutic use exemption aware, sports therapists can help protect the athlete for inadvertently doping violations, ensure safe and ethical rehabilitation, and uphold clean sport principles.